this episode of the Mama Podcast. Today we are joined by midwife Lily, who is also known as Frombumpstobabies on the social channels. Thank you so much for joining us, Lily. I follow your account and it's just absolutely brilliant. There's so much information that's really, really important for expectant parents, and I'm sure they all love you. So welcome to the podcast.
Thank you. Thank you so much for having me on. It's exciting. My first ever podcast, by the way.
Is it really?
Yeah. So I don't know what to expect, but I'm excited.
Oh, okay, well, that's made me feel nervous now. There's no pressure. Well, I'm sure we've got a lot to talk about. You share a lot of antenatal information, obviously, on your feed, which I'm absolutely passionate about. I love providing really important information to expectant parents. So we're really excited to have you. So why don't we start by you introducing yourself and telling us all about you and who midwife Lily is.
Yes, thank you. So I am midwife Lily. I run a page called Frombumpstobabies on Instagram, on TikTok. It started off in 2018, where I was living in Bicester in Oxfordshire at the time. We started some group antenatal classes just because this was pre-COVID, but during COVID as well, there just wasn't much to offer women via the NHS. A lot of things were online, or the uptake of it was small, so it was being cancelled. And I just saw that gap where, as an NHS midwife, I could give people education, realistic, evidence-based, from someone who is a midwife, delivering babies, looking after mums all day, every day. And yeah, just try to reduce birth trauma. That's my main aim, is that if I can't promise you'll have a vaginal birth or that you'll breastfeed your baby perfectly with no issues, but I can support you with reducing the impact of birth trauma or reducing the likelihood that it's going to happen, which is the main goal of Frombumpstobabies. So started that. Before that, in 2011, I trained as a midwife, when I was 18, and just kind of fell into that. And 13 years later, we are still cooking. And then the Frombumpstobabies is as well as NHS, so I'm super busy.
That is just amazing. I love your passion and your energy about wanting to educate women. It's just fantastic. So why do you think antenatal education is important for women?
I think for anything, information and education prior to the test or the event or the big life event, which is your birth and your labour and becoming parents for the first time. I hear so many times people say, I'll swing it, I'll just see what happens. My midwife will support me, or my birth partner will know, or I've been looking on TikTok or whatever. And it fills me with dread, because I think you would never do your GCSEs without revising, or your A levels, or take your driving test without any lessons. And that is exactly the same for birth, that if you go into that huge life event, bear in mind you will be tired, you'll be sometimes in pain. It's very easy to be overwhelmed, unlike when you are taking a test or getting that job interview or whatever it is. You've slept usually a little bit before, and you've not got any of the other physical factors going on. So to wing it leaves you very open to bias from other people. You know how we always just say, oh, the doctor said to do this, so I just did it. That isn't always the best option for you too. If you're preparing to be your biggest advocate in your birth, you can't do that without any prior education.
That is so true. I think it comes back to the fact that you don't know what you don't know until you wish that you'd known about it.
Yeah.
And that's the thing. It's always like after the event, once you've been through something, you're like, oh my gosh, I wish I'd found that out, or I wish I knew what the best option was for me here, or I wish somebody had told me about that. And you're absolutely right. If you don't do your homework and your research, how do you know what your options are and what your choices are? Because at the time when you're faced with certain situations and you've got to make a decision, and all you've got in front of you is one particular healthcare professional that's sort of, advising you, you've got to make a decision quick.
Yeah.
You don't have time there and then to sort of go away and do your homework at that point. So yeah, it's so important to know what you need to know beforehand. What do you think is the most sort of crucial piece of information that every pregnant should know at the start of pregnancy?
Um, I think that being really mindful that it's a huge deal, that we haven't just had a baby and we just get on with it, and we're not just pregnant and then our mind ignores that for 9 months and carries on with the rest of our life. Like, it's a huge life event that you need to prepare for, but also slow down for. And I wish many people did realize that and decided that at this time, whilst I'm pregnant, I'm going to set better boundaries, reduce my work, make better relationships, or cut off the relationships that don't serve me anymore, because growing a child is a big enough job compared to growing a child and tackling negativity from people, from work, whatever it is. But protecting your mental health is vital. If you haven't done that, or if you're not in a position to be able to do that, there is support available to you. But you do have to be quite proactive in making a choice to do that. And assuming that you can be pregnant whilst juggling everything else, I think is going to make it difficult.
That is such a great piece of advice, and one that I wish I had
Yeah.
taken as well, thinking about it, because actually during that 9 months, you've got time to prepare for a different lifestyle,
Yeah.
really.
Yeah.
Because when baby arrives, it's a huge shock to the system, and then it's very hard to sort of change everything all at one time. So we need to, you're right, we need to get into that mindset before the baby arrives of
Yeah.
looking after ourselves, because as soon as that baby's here, everything's about the baby. It's all about the baby. We completely forget as mums to look after us.
Mm,
So I think actually that's really good training to do that before the baby comes, to start thinking about ourselves and how we can look after ourselves and get self-care. And you're right, that rest and that time, and to say to people, to actually have the guts to say to people, actually it's not convenient to come over today, would you
yeah.
mind coming over tomorrow, or that sort of thing. That's really, really helpful.
Protecting.
um
I do think that one of the biggest backlash that I get on social media is people saying, it's not realistic, I can't rest, I can't slow down, you must be really lucky if you can do that whilst you're pregnant. And it makes me really sad, because it's not me explaining that I think we think in order to rest, slow down, take time away from work, we need to be loaded. We need to have loads of people around us to take the child away from us and look after the baby for us. But it really can be very simple, just starting at home, whatever you can manage. If you are a single parent, trying to draft in people that will be there for you, finding a really good friend that maybe you haven't connected with for a while. So it's not that you have to be super rich and super wealthy in friends and family to be able to prioritize yourself. We can just do it in our own little way.
Definitely, yeah. It's in the small things,
Mm,
isn't it? And it's
yeah,
having a different mindset. So it's saying, do you know what? Does it matter if the washing up doesn't get done till tomorrow? Does that really have to be done right now? Maybe it's best that I do sort of 2 or 3 lots in one go,
yeah,
rather than keeping on top of it. It's only a temporary thing. So it is just shifting that mindset. And as you say, just maybe some relationships aren't particularly
mhm,
helpful during this time, during this period. Um, so it's choosing who you connect with, who you meet up with. And it's okay to say no. Like sometimes you can say, "Oh, girls, I'm so sorry, but having a bit of a rubbish day. Do you mind
mhm.
if I catch up with you next week instead of now?" Just don't push yourself beyond the limits that you would perhaps usually do,
Yeah,
maybe.
absolutely.
That's really, really helpful. And what do you think is the most surprising, like, misconception new parents have about antenatal education? Is there anything, do you think, that would put them off?
I think people think they're cringe, and I think they think, I can't bear sitting in a room doing role play. I'm thinking especially for birth partners, because I
Yeah.
think when you're pregnant, you probably think, well, I've got to push a baby out in a couple of months, and so I've got to get over that cringe and just do it. But I think birth partners come in, a lot of dads to be, I can tell they've been dragged there. They don't really want to be there. And it's so lovely to see by the end of the course how they actually are like, all right, yeah, I do see how I should have come, and I'm glad I did. And I see how I didn't think it was necessary, but it absolutely is. Like you said, Heidi, you don't know what you don't know. But I do think people think they're cringe, and that might predate to, like, historically antenatal classes where you would be told, this is how you birth a baby and this is how you feed a baby, and let's pretend you're the midwife and I'm the patient. And when I was training, we used to do stuff where my lecturers teaching me about birth would be the mum and start crying, and it'd be so awkward trying to learn in an environment like that. So we're not like that, Bumpstobabies. We're so chill. You come in, relax. If you want to take notes, you can. If not, just sit back and watch and listen. And we're not going to make you stand up and talk. The worst thing you have to do is introduce yourself and tell us who you are. But after that, you could stay silent the whole time if you wish, but I bet you won't. You'll start chatting as time goes on.
Yeah, and you get to meet lots of other people, don't you, that are having babies around the same time. I think maybe there is a misconception in the media because because it's not something that we're going to every day of our lives, an antenatal
Mm.
class. I think the only sort of sighting and visual that we've had is through films or programs and things like that, where it's, I don't know, it's in EastEnders or something.
Yeah.
And so you just see like the dad's behind the mom sort of rubbing her back and doing some breathing exercises with
Yeah.
her, and that's the cringe factor, isn't it? And you're just like, oh gosh, how embarrassing. um but actually it's not like that. It's not what you see in EastEnders, if you like. So
Hmm.
yeah, I think that's really interesting, and hopefully that's going to help some partners out there
Yeah.
when
To
they're
come.
being asked to go.
Yeah, when they're
Yeah.
being told to come and accompany. I mean, we obviously can bring anybody with you, your friend, your mum, anybody that you want. But ideally, it should be the person that's in your birthing room with you. They need to know what to do. You're not going to be in a headspace where you can always communicate fully with your midwife or express exactly how you feel. And you need somebody that loves you and understands you to look at you and say, yeah, she's not right, or even without words, I know my partner would know what I was meaning if I just stared at him. And that's
Yeah,
what you need. As a midwife, it's so much pressure and responsibility for me to look after you. If I've never met you, maybe we haven't even had a conversation because you're coming in labour and I can't disturb you. And so then I'm trying to look after you how I think you would want. And that's not always right because we're so different. I want to know exactly how you feel, and I can talk to your birth partner who hopefully can explain what you like as a person and what you do and don't like and that kind of thing.
definitely. Yeah, that's so important because we all communicate in different ways, don't we? We all use different languages, we've all got different accents.
Mhm.
And you're right, that's really hard for you as the midwife to decipher that. And so I think some really good education in the antenatal classes is for partners and advocacy, to look out for certain signs, to recognize when your partner is in distress and not coping. And that's when you learn how to
Mm,
advocate for them and how to go and find the midwife and say, oh, actually, I don't think this pain relief is helping. I don't think it's quite working. Is there something else that we can try? Can we move on to something else now? And you can have that plan with your partner at home, can't you?
yeah,
You can even write it down for them and put it in their pocket, put it in your hospital bag. So when they're thinking, oh gosh, what was it that we decided? They can then get it out of the bag, and then they can let the healthcare
yeah,
professional know what your choices were at that time.
yeah.
And you can also change your mind as well.
Always. First plan is not there to stick to if you don't want to. It's just there to guide you when you're feeling a bit lost. So yeah, you can change your mind every 5 minutes if you want.
And what are the most sort of common questions that parents would ask or want to know about in the classes?
Um, I mean, we do a 4-week course, 2 hours each night, and we get question after question after question, and often it is, "This is a really stupid question," but followed by a really unstupid question that I think, "Thank God you asked that," and loads of people are like, "Oh, yeah, I was gonna ask that too, but I couldn't, or I was too embarrassed." So, I think we get a lot of worries. I'm worried about, and that turns into a question, and a discussion after that. But I think biggest things are, will I open my bowels in labour? That's the most asked question I've ever had in my life. What if I do a poo? What will happen? How's it going to go down? Who's
Right.
going to see?
Yeah.
And of course, we know
And
that,
again, where do we get that from? That must be from media or
yeah,
something like that, because it can't be that common. I mean, okay, it can happen,
yeah,
but it's not as if that's something that is guaranteed that's going to happen to everybody doing every
yeah.
birth. Where did we get that from?
Well, I think, when your friends, you tell somebody you're pregnant, and then everybody starts giving you these horror stories of, oh my God, when I had my baby, this happened. And
Yeah.
as a midwife, I listen to that, and sometimes I think that's not helpful to the person. We all want realistic evaluation of how it went, but if you're scaring me, I need to just close off to that. So I think it is a case of, we just, sometimes people might find it funny, or people might find it, they can give you that shock factor. And as a midwife, I can tell you that most people do empty their bowels, and if they said, oh, did I or did I not, usually I say, oh darling, don't worry, don't talk about that, it didn't happen, and I'll just pretend that nothing happened. So that person might go home and say, well, I didn't poo in labour because I've said she didn't when she did.
Mm.
It's, we're not there to say, look at this, look what's happened, take a look at this. And we're certainly not going to say to your birth partner, come and have a look at, how this looks. So birth is sacred, and we want to keep you private, we want to keep you protected. If that was to happen, or when that happens, you're probably not even going to know about it, just like you won't
Yeah.
want to usually. So you're going to be protected by your midwife physically and emotionally, so you're not going to feel embarrassed or nervous. So I do say, well, what if you have a poo? Who cares? What happens? Nothing.
Yeah, that's amazing. That's amazing. So let's nip that in the bud and clear that up now, that actually the majority of people wouldn't even know that they had done so.
Yeah,
And at that point, you are not thinking about that. Like, that is the last thing
yeah,
when you're actually in that moment. That is the last thing on your mind, because you are focusing on bringing a new human being into the
mhm,
world. And how incredible is that? And the fact that it happens, and that is your proudest moment in life, when you
yeah,
are handed that baby and you think, oh my gosh, I did it, I did that. So that's definitely the focus, and not whether you happen to poo in the middle of
yeah.
it.
And like you said, that comes at the end. So as a midwife, when I see that happening, I'm like scrambling, getting my gloves on, getting all excited, because I know your baby's head's going to come out now. So it's
Mm,
a really good sign. If you could take yourself to the toilet, you would go to the toilet. You wouldn't just lie there or stand there. So it's so involuntary, you can't help it. And it's your body showing you, let's move your bowels so that we can move your baby. And the more you suck everything up and stop that from happening, the more your baby goes higher and higher and higher until we can't get them out. So we do need to just let your body take control.
absolutely. That makes complete sense. Um, what do you think is that the most embarrassing thing? Do you think that parents want to ask, or are there any other things that they perhaps sort of shy away from, and don't necessarily mention because of the embarrassment factor?
I think it is people, I do think that's a really high on the list of my embarrassing questions. And I don't know if it's because I'm a midwife or just my personality, but there's not a lot that I get embarrassed about or that you can shock me with. So sometimes when my clients or my patients might say, oh, bit TMI, but, or if I check their stitches or something and they say, oh, sorry, I don't want you to have to look. And I'm like, babes, it's my job. This is what I do all the time. And so it's never ever awkward for us. But I do think people, when I mention about perineal massage, and they're like, pardon, what do I do? When do I do? So it is a bit of a taboo. the research is there to show if you massage your perineum from 34 weeks onwards, you can reduce your risk of perineal tearing. So I feel like you'd have to be crazy to just ignore that and never do it and never try to do it. But I know that because it's very intimate and it might be a little
Mm,
bit uncomfortable, maybe you
mm.
can't physically do it because your bump's in the way. And then their eyes widen even more when I say, "We'll get your partners to do it." And then they're like, "But you've conceived a baby. We know that you can do that." So it is just about trying to create a space where in my appointments, in our sessions, people can feel comfortable to ask me directly or explicitly, "How do you do that? Show me how you do this. How do I know I'm doing it right?" But if you shy away from things and you don't ask the questions, you don't then do the things that we need you to do. And so in labour, when the midwife says, "Did you do perineal massage?" we want you to say, "Yeah," rather than we see the dread wash over you where you think, "Oh my God, no, and now I've got to push this baby out." So it's all about trying to prepare your body to go ahead and have a baby as safely as possible.
I'm so pleased you've mentioned that. I'm so pleased you mentioned it because we went to the South Asian Maternity Conference back in the
Mm,
summer, and perineal massage came up because, like you say, it really can reduce the risks of tears and therefore birth trauma. So we now have that on our wellbeing wallets. We have it on the pregnancy passports. We've got information about it all on our website. And I think the way that you bring up the subject, as in just asking them, have you done it, is going to make them think about it. They might not have been starting it yet, but it's going to make them think about it. And then obviously that opens up that discussion, doesn't it, for you to
mm,
then talk them through how to do it. It is nothing to be embarrassed about because, like you say, it's just stretching the skin. It's just getting the body ready and prepared for birth. But how would you talk to women of a certain culture where it would feel even more awkward and even more embarrassing for them, such as the Asian community? Because I know they would feel really uncomfortable talking to their partners about it, for example. So how do you go about discussing it with them?
I think it's really important as a midwife to be really mindful that although I'm a white British woman and this is how I would want my care to be delivered to me, and on social media sometimes I can be a bit brash and a bit loud and not shy away from sensitive topics. So hopefully their midwife will be aware and sensitive to their needs and their cultural needs. I think it depends if they've brought somebody with them. If you are bringing a partner with you to your antenatal appointments, you need to know that there will be some questions there that you're asked that you do have to feel comfortable answering in front of that person. So people might bring their nan, or I've had people bring their dad before, and I'm thinking, "Oh my God, your dad's in the room, and I'm going to ask you if you've hand expressed." But I'm assuming that you're comfortable. So I would start off with, "Are you comfortable talking about this?" If it's a no, I'm not going to push her to keep talking about it. That's fine. Let's revisit another time and then again chat a bit later. But perhaps it could come with, "Scan this QR code when you're in private," or "Have a look at this leaflet tonight when you get back." We I have a lot of WhatsApp contact with my women, so they can WhatsApp me when they are alone and voice note and say, "I didn't want to talk to you earlier about this, but," and can ask me those questions. But the information I give is yours to take. I can't force you to take it. And there's never an agenda apart from trying to keep you well and healthy. So if you choose that that section of your information, Lily, is not for me, that's up to you. That's totally fine.
That's brilliant. I love the WhatsApp communication. That's so helpful. And also, things come to us in the middle of the night sometimes, don't
Mm,
they? And you just think, oh, I could just if I just write that down or if I just zap that off,
yeah.
then they won't forget. And then obviously you pick it up the next day. So that's just fantastic. How can parents like prepare themselves emotionally as well? Because we've talked a lot about the sort of physical practicalities.
Yeah.
But what's the emotional changes that they can prepare for?
I think, do you know that phrase about, I'm not going to get it spot on, but you shouldn't go to therapy when you need therapy, or however it goes.
Hmm.
You should go to therapy when you're well and you're healthy, because when we are mentally well, we can be realistic. We can be will sit there and think logically that doesn't sound how it actually is, and I know with my rational brain I can process that better. I feel like when we've hit a point where we are going down, and I've had this myself, you start to feel a bit low, and you know that's the point when you should have done something, but we don't. We carry on and we let it spiral. And it's not until the very end that we then have some help, which hopefully it's not too late ever, but it does feel like we could have done something a little bit sooner. So I do want all of the women that I look after, or all the people that I know online, to be able to reach out to me or their midwife to talk about their feelings. Protecting your mental health comes from acknowledging there's a little bit of an issue, might not be huge, but it's a tiny issue or a significant issue, and seeking some support and help. If things go on their own naturally, sometimes it's just a bit of a fluke and they went, and that's great. Or sometimes we did something subconsciously that made us feel happier, or sometimes we had professional help that helped us. So I would say we can't just leave a problem and ignore the problem, because eventually being a mum or being a dad for the first time, that is going to give you huge responsibility, huge questions every day. You're going to doubt your abilities and whether you want to do this, whether you can do this, never mind the ongoing mental health issues that you might have. So I would say definitely to sort as much through that as possible before pregnancy, and if that's not possible, then during your pregnancy.
Amazing. That's really good food for thought. Um, is there anything that parents always say, oh gosh, I wish I'd known about that beforehand? Because we spoke about that earlier. Is there a common thing that parents usually say to you, oh, I wish I'd known about that because it was too late during labor, childbirth, or whatever?
Yeah, I think we probably take for granted how to actually push a baby out. I think we see online, especially with hypnobirthing, which I'm a huge advocate for. I love hypnobirthing, but it doesn't help for everybody. And most people, if you've not had any pain relief on board, like an epidural or the pethidine injection, you can or you should feel this natural involuntary urge to push, that even if I told you not to push, you'd still push because it just takes over your whole body. But for the women who don't get that or have pain relief that means they don't feel that, me teaching them how to push the baby out right now, I think if they'd have known how to do that a little bit earlier in their pregnancy, that would help. Because we talk about it's into your bowels and you don't make any noise, but again, on the films and on EastEnders, these women are sweating, they're shouting, they're screaming, and you haven't got any oomph behind your pushes if it's all coming out your mouth. So
Hmm.
trying to teach that really quickly almost feels like a bit of a panic of, you do this, then you put your chin down to your chest. So if women knew and almost in bed at night imagined how they're going to push their baby out, they might never need that skill because it just happens naturally. But when they do, if they do, they've got it under their belt. And because, with mums and dads first child, um, in the NHS, there's a certain time that you've got to push your first baby out, and after the time frame, the intervention is offered to you. So we can waste a lot of those couple of hours by learning how to push, but that's all counted in your pushing time. So if we could just crack on and push for 2 hours instead of talking about it, then we would probably have less intervention.
That is amazing. I did not realize that at all. When
Mm.
does pushing time start? Is that usually when it's found that the woman is sort of 10 centimeters dilated?
Yeah, so either you're telling me you're 10 centimeters verbally because you're saying, Lily, I need to push this baby out, or you're not speaking, but I can see. There's lots of different ways that as a midwife we would notice. So lines on their bottom, the way they're behaving, the way that she's vocalizing her contractions now. But if not, if we've diagnosed 10 centimeters because we've examined somebody and they've got an epidural, so they didn't know they were 10 centimeters, then I would say, right, now we're 10 centimeters. We can do something called a passive hour, where we just leave the baby at 10 centimeters to just descend down the birth canal. And sometimes they genuinely pop out on their own. You can see a little bit of their head, and then we start getting ready. But after that hour, that's given as much time as you can to just let the baby come down the birth canal, and then you start to push. And that's usually what you can only push a baby out once you get to 10 centimeters.
Wow, I did not know that. I did not know about the time factor, and you're right, you can waste so much time learning and getting the technique right, etc. Before you can actually do it. So that is a great tip. That is a brilliant tip. Um, Thinking about the most important piece of information that you think parents should know, what topic do you think that they need to make sure they attend for, that when they're looking at the program, they think, oh, that's the one I need to go to?
I'm like all of it. I would say you have to come to all of it, but I think labour, provided we haven't got the intervention, and obviously that's there to help somebody, but if our labour and our birth all goes fine, swimmingly, you feel in control, you feel happy, perhaps you, with a bit of luck, perhaps you didn't need education and it just all happened like that, and I would be so pleased for somebody that it happened for. I think what you absolutely can't wing is breastfeeding. So when your baby's born, if left to their own devices, I don't know if you've seen the breast crawl video, it's sped up, but the baby basically is put on mum's belly and crawls up to latch on. And when I watch it, I think I mean, this was before AI, but I think that can't be true. It is true. We just don't have enough time in the NHS to allow that, for that to happen. And so things feel rushed. We want the baby to latch within the hour, but how do we expect to latch her baby when we're also doing stitches for her, getting her placenta out, asking if she's okay, trying to make her eat something so that she can get her strength back? All this time you're trying to focus on how to feed your baby. And some babies pop out knowing exactly what to do, almost like they've been here before and they just know. And so a mum who doesn't know what to do, that baby will teach her. But most of the time, you have to teach your baby. They know how to suck, they know how to sniff around and latch on in a certain sense. But if it's painful, if there's not effective milk transfer, if there's signs of dehydration, you need to alert midwives to that, or you need to know yourself so that we can help if we need to. Your midwife will come around every couple of days, but in the meantime, and usually the problems are always at night, you need to know what you do if X, Y, and Z happens. And that's what we teach. So I would say try not to wing your breastfeeding. That will sometimes end in wanting to stop because you feel like it didn't work. So many mums say that, oh, I couldn't breastfeed. And it breaks my heart because I think you can breastfeed. You just needed a bit more help. Unless you've had breast surgery, breast cancer, like a real issue with nipple realignment or something like that, you can breastfeed, but it sometimes becomes so difficult that we have to stop. And if we can intervene before it becomes so difficult as midwives, then we can maybe prolong their breastfeeding journey a little bit.
What breastfeeding support is there out there? Because if you do really struggle, and I really, really struggled, where can you go for help? Where can you get that support afterwards?
So your NHS midwife is available for, well, saying that, the other day I did a video about how you shouldn't leave your home for the first 15 days after a baby, and everybody, some people were saying, yep, agree. A lot of people were saying, how do you get your midwife help? And what I realised, even though I've worked in 4 hospitals in the UK and all of them did the same, there are some hospitals where you have to go to get your appointment after the baby, which baffled me. I didn't realise that was happening, because I can't imagine trying to get your baby in the car and get to the place and then have like a timed 30-minute appointment, really conscious that the midwife is going to have the next person in. So you need home visits, I would say. Your midwife, your support worker, the health visitor, all in that team, health professional team after, are available to come and give you breastfeeding support. So there are days, the first day, the 5th day, and the 10th day, that we come round for every mum and baby. But in between that, I would never mind if someone rang and said, can I just have some breastfeeding help? Can you just watch me breastfeed? If you're in a place in a trust that don't do home visits, then I would say you've got the children's centres. Again, I'm really mindful as I say that some of them have closed down around the UK, and this is that we're in at the moment, that our budget's gone down nationally. and things have been shut down with no replacement. So I get that there isn't as much free help available, and unfortunately people that can't afford to pay for the lactation consultant or the online midwife, that's where we stumble. But hopefully the little reels that I do and the little bite-sized bits of information, that's all for free, and the free guides as well on my website, and charities like you guys, that's what we can try and access. But I guess you need to know about them before you need them, so that you know who to Google and how to find them.
Definitely, definitely. But that sounds like a massive step forward. I mean, my daughter's 11 now. So we're going back 11 years now. And I did really struggle, and there wasn't the midwives coming out. There wasn't the healthcare visitors coming out back then. I think we had one sort of follow-up checkup visit, that was it. And so I did have to take myself off to the children's centre, which again, in my area in Surrey, there aren't any anymore.
Mm.
And it was a group session. There's lots of older siblings, all the toddlers running around as well, so it's noisy, it's busy. It was quite hard, but it sounds like you've got some fantastic services now. We've got a lot of breastfeeding services on our maternity directory on our website, so people can just look at their county, drop the box down, and then see what's in their area. So you can give them a call, email them, see what's available for you. That sounds amazing. I'm just thinking about antenatal classes for pregnancy after loss,
Mm.
and how that works and what the options are nowadays. Because for me, I did antenatal classes with my first son, but after I had my loss, I didn't do antenatal classes again with my other two,
Mm.
because, well, for obvious reasons, I think. So what advice would you have for someone that's got having their rainbow baby?
Yeah, I think if you're having your rainbow baby, maybe a group setting might be helpful. There might be, I think with loss, you'll know this, Heidi, that we just don't talk about it. So you might be sat next to somebody that has experienced very similar, but she's not told you and you've not told her. And it's not until you open up. So maybe it would be a good experience. But for things when we've experienced loss, especially baby loss, I think there's a lot of resentment that it's happened to me, and going to a group of people who are maybe experiencing their first pregnancy and don't have the same worries that you have because it hasn't happened to them. You almost, sometimes I can look at people and think, you're so lucky. You're so lucky that you don't feel the way that I feel. And that might brew when you're in this group setting. But I do think if you gave it a chance, there will be people who have experienced loss, bereavement of some kind. Maybe if you're experiencing the loss, or you've had the loss before you have a baby again, you might decide that you want to seek out somebody that you feel comfortable with, who will provide your antenatal education when you have your rainbow baby. And possibly one-to-ones might be more your thing, where some of the session we may have booked an antenatal education, but some of the session or all of the sessions might be talking about your baby that you lost, and it might be discussing things that aren't on our typical agenda. But that's the beauty of personalized continuity of care, is that we can just talk about whatever you want to talk about. And if that fills you with excitement and you're then ready to birth your baby, rather than fills you with dread or worry, or feeling like you're not in the same group that the other girls are in your class, or you don't have the same feelings as the other girls, that might feel a bit isolating. So maybe one-to-one with a bit more personalized approach might be better for you.
Yeah, definitely. I think for me, I couldn't do anything when I had my son, who was my first rainbow baby. Yeah, I wasn't ready to do anything. But when I then went on to have my daughter, um, I thought, well, I'll do something different. I'll
Mm.
change the narrative. I
Mm.
can't do the same sort of thing as I did with my first son, Aiden, but I'll do something different with her. So I went to hypnobirthing
Yeah.
classes. So it wasn't antenatal education. At that point, I'd started up the charity. So I
Mm.
felt like I knew quite a bit anyway, obviously, because I was pushing these safe and pregnancy messages out left, right, and centre. So I did the hypnobirthing, which is obviously focusing on breathing techniques. It's focusing
Mm.
on mindfulness, and I really enjoyed those actually. It wasn't sessions to discuss and chat and talk to other women because I didn't really want to do that. I didn't
Mm.
really want to talk about my pregnancy. But yeah, it was really, really good. And I ended up having a C-section with Tilly. She was an emergency C-section because I was induced. But what happened with the hypnobirthing is that knowledge has been beneficial for me all through my life because when I've gone through certain periods of pain, I had calcific tendonitis in my rotator cuff, for instance, and that was really painful at the time. So these techniques that I'd learned years before, they all kicked in. They're in your subconscious somewhere,
Yeah.
and you can learn to breathe through certain things. And that happens mentally as well when the kids are absolutely driving me crazy. I just go into a corner and I
Yeah.
just focus on my breathing before I say something that I shouldn't. So yeah, all these techniques, they're life skills, aren't they? And they can really
Mm.
help you for a long time. So I would just say, yeah, do something different that you didn't do before, because that really helps. And with my daughter, I went to a different hospital as well, for
Yeah.
instance. That all helps, seeing different faces, going into a different building. That can really help as well. So there are options. It's not to think that there aren't any options for you. There are definitely options out there, and a lot more support these days than there used to be. That's for
Yeah.
certain.
I think as well, letting us know what you've experienced in your past as well, what's happened before, what your first baby was called, or maybe it was your second baby, so that we can talk to you about your baby rather than nobody mentions anything and we all just sit there without anything to say. So it's about saying so that we don't, because obviously I'm a midwife, but I'm also a person and a human. And sometimes I'll say things and think, why did I say that? That's so cringe, because I just haven't realised who I'm talking to or what experiences she's had. So that's why the personalised care is there. Sometimes I have women who have sadly lost their first child. Second time they come to see me again, and I say, you don't have to have me again. I can get you a new midwife just to switch it up, like you say. And I cry when they say, no, I want you again.
Mm.
To see those women and families having their rainbow baby when they've experienced such grief is just the highlight of my job.
Yeah, I bet that's wonderful because it's so lovely for us as well because we want to go full circle, obviously. We want there to be a happy ending,
Yeah.
to get that pot of gold at the end of the rainbow. And so for you to be involved in the whole journey is just wonderful for us because you will, especially through a loss, you will be embedded in our mind and our,
Yeah.
our our lives forever. We'll never forget your face, we'll never forget your name. And so it's wonderful if you can then be part of the joy rather than just associated with the sorrow. So
Yeah.
I think
Yeah.
that's wonderful. Um, just to sort of finish off, is there anything that you would change in the antenatal classes? Is there anything that you think could be more modernized or updated? What would be the one thing that you'd like to see done differently?
I think in terms of generalised antenatal classes, because obviously at Bumps to Babies we're perfect, we
Of
operate a
course.
perfect service. Um, and I know that other people do other courses, and without mentioning names, the reason why we brought Bumps to Babies to life, or I did in my living room, was to try and be a caveat to other courses available, because I thought I can do better, I can show more, I can educate better in a different way. So we need, as a whole community of midwives, healthcare professionals, to be modern. We are modern women. We have other things going on. We sometimes don't want to have a vaginal birth, and it's not about too posh to push or anything like that. We just don't like that idea. Luckily, we're becoming, as a trust or mainstream, you can have a C-section for no reason now, which is perfect. That's how it should be. We shouldn't be forced into vaginal birth and breastfeeding and whatever else we've got. So I think we need to just have an atmosphere where you can come in, you can explore all of the options, And I do say to people, I don't care how you feed your baby, as long as you feed your baby and as long as it's informed. I don't want you to think that breastfeeding is difficult and formula feeding is easy or whatever, and have a misconception that it's my job to show you that that is a misconception. But whatever you do with that information is totally up to you. So come in, get the realistic, honest, evidence-based, modern information, and then leave and do what you want with it. It is not good or safe to go in and have a standardized care pathway of this is how you do it, and if it changes, you haven't birthed properly, or that's not how we birth. That is just going to lead to the trauma. And I think if you've had good education and good support, you could have had maybe what I would class as a really, really traumatic birth that on paper sounds awful and nobody would want to experience that. And some of the women I look after are like, yeah, it was fine. I felt empowered. I felt safe. And it's the safety aspect that we need. If at any point during your labour and birth, if you don't feel safe, that's what is going to traumatize you. So it doesn't matter how you have your baby, really. I know we'd all probably like a low risk birth, but as long as you felt cared for and as long as you felt safe, that will lead you to a happy postnatal period, hopefully.
I love that. I think that's fantastic. We're huge advocates of informed choice. You can't make a decision if you don't know what your choices are,
Mm-hmm.
and they need to be given in a very factual, non-biased way, with all the facts, all the pros, all the cons. And I know that's not always happening at the moment, because bias does kick in, or there's time constraints usually because
Mm-hmm.
there's, a lack of resources and a lack of staffing. It's very rushed, and therefore perhaps maybe women aren't making the choices that they might necessarily have done in a different circumstance. So I think that's great. I think having that choice and that time and finding out all the information, and that's primarily what education is, isn't it? Antenatal education is about knowing all the information in front of you and being prepared so you can make the right decision for you. So I think that's fantastic. I think that's real empowerment there, I think.
Absolutely. We want you to be confident in your choice. So when you're swaying a bit and you're asking a lot of opinions off people and you're not really sure, if then somebody tells you something controversial to your opinion, if you're not sure on your choice, you might then be swayed, like you said, bias of somebody else kicks in. You start to then maybe just follow them because they're a healthcare professional or they've had 6 babies and you've not had one yet. If you are confident in the choice you're making, no matter what, you know it's the right one for you. And I really urge everybody, make those choices on your sofa with a cup of tea, but after a good night's sleep, having no pain, rather than trying to make them mid-labour or mid-breastfeed when you're shattered. And no wonder at that point you might say, get me an epidural, get me a C-section. No wonder you're so tired. So if you've made choices before with your rational brain, then things usually work out a little bit easier for you.
Absolutely. Thank you so much, Lily. This has been fabulous. You mentioned From Bumps to Babies and how fabulous your courses are. What areas of the country are you in? Where can parents access your particular antenatal class?
So we're worldwide. Literally had a lady from Australia a couple of weeks ago, Brazil, online. Obviously, I didn't go to her house. So online, anywhere we can make the time zone fit. Or if you want a group face-to-face class, we run them in Bicester in Oxfordshire and in Solihull in the West Midlands.
That's fabulous. And where can people find you? What's your website?
Website is frombumpstobabies.net. And then on socials, you'll find me doing silly videos with a bit of education around it at Frombumpstobabies.
Fabulous, fabulous. Well, we wish you all the best, Lily. Thank you so much for everything you're doing for expectant parents. It's just absolutely wonderful. We're huge fans, and yeah, we just wish you all the best. Thank you so much for joining us.
Thank you so much.